Remember that neurotransmitters, the major ones are serotonin, dopamine, norepinephrine, and epinephrine. So that's the way our brain cells communicate with each other. So serotonin is really important for good mood, social behavior, appetite and digestion, sleep, memory, and sexual desire. That's in the brain. It also has a role in our metabolism, in our motility of the food we eat in our digestion tract. In humans, 95% of the serotonin is found within the gastrointestinal tract, which regulates the digestion. And in the brain, it is synthesized from tryptophan. Tryptophan is found in the early 1900s after isolating it from casein protein. It's one of 8 essential amino acids and is used in protein synthesis and can pass across the blood-brain barrier. Our body has a very low ability to store tryptophan, so we constantly need to synthesize more. It is found in small amounts in the body that is synthesized out of amino acids. It's really high in turkey. So that sleepy feeling after you get into Thanksgiving meal, that's most likely because of tryptophan that causes you to be kind of all relaxed. It's also found in tuna fish, cheese, bread, chicken, peanuts, chocolate, bananas, and tryptophan supplements were banned in the US from 1988 to 2001 because of contamination in supplements manufactured by Shuwa Denka Company of Japan. So that's why I keep telling you guys to always buy supplements from reliable companies. For example, a good company that is really affordable and has a long track record is a company called Now. And if you want more professional grade supplements, then Pure Encapsulation is another supplement company that have more of a professional grade supplements. So how is tryptophan related to serotonin and all these other neurotransmitters? So in our body, 90 to 99% of a tryptophan is converted to kynurenine through the kynurenine pathway. It's a pathway that plays a critical role in generating cellular energy in the form of nicotinamide adenine dinucleotide, which is NAD, which our mitochondria is using to create ATPs, create energy. That's a really important factor that plays in energy production. Tryptophan, the rest of the tryptophan is converted into 5-HTP, which you can also buy as a supplement. We'll talk about it in a moment. And then is converted to serotonin, which requires B6. So if patient does not have sufficient amount of B6, then they might not convert 5-HTP to serotonin properly. Only 3% of the dietary tryptophan is used for serotonin and in the body and 1% in the brain. Now, our body also converts 5-HTP and serotonin into melatonin, depending on the amount that the body needs. And remember that melatonin is really important for our cyclical rhythm of sleep and awake. And it also influences reproductive and immune systems. And its synthesis is regulated by blue light spectrum and sunlight. So when you expose yourself to light, our body secretes cortisol. When you're dimming the lights at nighttime, our body's starting to secrete melatonin. If you expose yourself to computers, lights, watching TV before you go to sleep, and if it's after 10 or 11 p.m., your cortisol will reduce the melatonin because cortisol is an antagonist to melatonin. So with our patients, it's really important to make sure that they do shut down everything an hour or two before they go to sleep in order to make sure that they got sufficient amount of melatonin, which is really important for brain health. And then oral consumption of L-tryptophan was also reported to increase levels of dopamine, norepinephrine, epinephrine, and beta endorphin. The absorption of tryptophan is reduced when other amino acids are consumed. Tryptophan-free diet was reported to increase depression. The effectiveness of tryptophan in studies produced conflicting results. So interestingly, it's important to notice with some patients that maybe they're going on a paleo diet, maybe they're going on a ketogenic diet, They now cut off majority of their carbs. We have to make sure that they do still get foods that have L-tryptophan, because otherwise they're going to be more prone to getting the anxiety or depression. Systematic review on the effect of L-tryptophan supplementation on mood and emotional state reported that taking 140 milligrams to 3 grams of tryptophan per day in addition to the usual meals can be expected to improve the mood of healthy individuals. So supplementing L-tryptophan might be beneficial for some patients, and about 2,500 milligrams of L-tryptophan at bedtime was reported to significantly improve obstructive sleep apnea, but not central sleep apnea. So if you have patients taking L-tryptophan, I would recommend do it in the evenings, especially before they go to sleep, because some of it will be converted to serotonin, some of it will be converted to melatonin, so it's going to be beneficial for better sleep as well. There's an interesting study that it was just a 4-day study. They compared a diet that is rich in L-tryptophan versus a diet that is low in tryptophan. And those were 25 young, healthy adults. And foods high in tryptophan are turkey, chicken, cheese, oats, soy products, nut and cheese, pumpkin seeds, tomato, bananas, egg whites. And we have some in vegetables like leafy green, mushroom, broccoli, and peas. And the study indicated that participants consuming higher levels of tryptophan had significantly less depression and irritability and decreased anxiety than the group that consumed lower amounts of L-tryptophan. Conversion of L-tryptophan to serotonin requires the presence of vitamin B6. With patients that have anxiety, depression, I would typically recommend to make sure that they consume the B vitamins, especially the B1, 6, and 12, because even just B12 deficiency contribute to depression. So make sure that they have those sufficient amounts of nutrients. And of course, 5-HTP, some of you might be familiar with 5-HTP, and 5-HTP is not found in foods. And absorption of 5-HTP is not affected by the presence of other amino acids. So consuming 5-HTP bypass the enzyme tryptophan hydroxylase, an enzyme with limited rate function which synthesizes 5-HTP from tryptophan and increases level of 5-HTP. And again, 5-HTP could be converted into serotonin if you have sufficient amount of B6 and to melatonin. But 70% of consumed 5-HTP will reach the bloodstream, which is really great absorption, and it crosses the blood-brain barrier and increases level of serotonin, which has an important role in regulating sleep, depression, anxiety, aggression, appetite, temperature, sexual behavior, and pain. Unfortunately, and this is the downside to 5-HTP, and this is why some practitioners prefer to use L-tryptophan. 5-HTP has higher bioavailability, but it's not sustainable. So it goes up and then it goes down very, very quickly. So for that reason, some supplement companies have created a sustained release 5-HTP, which means that it is released very slowly over the course of a few hours, right? And then you get a better, more stable levels of serotonin, and if your body needs it, then melatonin. And so, yes, there are different companies. You can use pure encapsulation, orthomolecular, and Design for Health. To answer the question, yes, those are also really good professional grade companies. And if you want to see other professional grade companies, I would recommend to register to Emerson Ecologic. And they have a golden and a silver badge when you search for supplements that were found to be fulfilling their quality assurance, right? So that's something to be aware of as well. 5-HTP supplements are made from seeds of the African plant Griffonia. Animal study published in 2019 reported that a slow-release supplements of 5-HTP restored low levels of 5-HTP in the central nervous system and reduced depressive-like behaviors. In a double-blind study with 26 hospitalized depressed patients, combination of chloromipyramine, 50 milligrams per day, with 5-HTP, 300 milligrams per day, was more effective than just the medication or the placebo. So 5-HTP, I would typically recommend to start at a 50 milligram dose for a week and increase by 50 milligrams every week afterwards. You want to do it very, very slowly, and monitor patients, especially if they're taking any type of SSRIs, because you want to avoid serotonin syndrome, which is too much serotonin. And when there's doubt, or if the patient is complex, then add one supplement at a time for a few weeks, at least 1 or 2 weeks. So then when they give you feedback, you know, is it this supplement, or is it that supplement, or is it something else, right? Which is sometimes better with complex patients. It's better to do that than give them 3 or 4 supplements. And then if there's an adverse reaction, you don't know what's caused it. Remember that excess serotonin or excess dopamine can also cause symptoms of depression or anxiety. So sometimes testing neurotransmitters is a really good place to start, because you can figure out, get more data, what's really happening there.